I'm Savannah. I'm a student nurse, and I'm going to teach you how to reconstitute and administer medication via the IV route. So to start off, I'm going to check my MAR against my doctor's order. So right patient is Emma Wrightson, right drug is methylprednisolone, right dose is 75 milligrams, right route is IV, and the right time is every 6 hours. It was given 6 hours ago, so it's due now. Emma is having a flare-up of MS, so that is why she is getting this steroid today. And she's also allergic to morphine, so I'll just keep note of that. Next, I'm going to go to my drug monograph and look at the methylprednisolone. It is a steroid, and it can be administered by a nurse or a student nurse, so I'm okay to give it. The usual dosage is 40 to 250 milligrams IV every 6 hours. I'm giving 75 milligrams, so that's right in the middle of that, so that is safe to give. And I'm going to look at the Reconstitution instructions here and note for a 125 milligram vial, which is what I have here, I'm going to be diluting it with 2 milliliters of sterile water for a final volume of 2 milliliters and a final concentration of 62.5 milligrams per milliliter. I'm also going to note that after I reconstitute it, I'm going to dilute it in either 50 to 100 milliliters of normal saline or D5W. So I'm going to choose to give it in normal saline because she doesn't have any other nutritional needs, so she doesn't need the D5W. And I'm going to choose to give it in a 100 milliliter bag because I just want it to be more dilute, so to lower any kinds of adverse side effects that she'll get. I'm also going to administer it over the longest amount of time, so 50 to 30 minutes. I'm going to choose the 30 minutes just so that I have more time to monitor her in case she's having those adverse side effects. Okay, anything else on the... So it's compatible with normal saline, which I know is what she's running right now. Okay, so we're good there. I'm going to perform hand hygiene before I gather my supplies. So, I have my vial of drug here, methylprednisolone. It's not expired and it can be given via the IV route. So I got that there. I've got my sterile water, some alcohol swabs, and my blunt fill needle, my syringe. So I'm going to begin by removing the caps on my vials, and I will swab the tops of each vial for 30 seconds and let them dry for 15. Get my syringe ready. Okay, so as per the drug monograph, I need to reconstitute my medication with 2 milliliters of sterile water. So I am injecting 2 milliliters of air, pulling out 2 milliliters of the sterile water.
Honestly, like, if we didn't grab for
Get rid of any bubbles there.
I think I feel like, yeah. Were you like forgetting?
Okay. So I've got my 2 milliliters of sterile water, which I'm going to put into my drug vial. Let back the air. Okay. I'll use my scoop method. Now I'll roll it between my palms gently so that I don't create any air bubbles. And once it's fully dissolved, I can now pull up my dose. Before I do that, I'm just going to swab the top again, just in case I touched it, just to be extra safe, for 30 seconds. Let it dry for 15. So for my calculations, I need to pull up 1.2 milliliters of the drug to get my dose of 75 milligrams. So 1.2 milliliters of air. I will inject it into my vial.
It's a real thing. You're doing this to your patient.
And pull up. 1.2. So 1.2 milliliters of the methylprednisolone there. So before I go any further, I'm going to do my second med check here. Right patient is Emma. Right drug is methylprednisolone. Right dose is 75 milligrams, which is 1.2 milliliters, which is what I have in my syringe. Right route is IV, and this can be given IV, and right time is now. So now I'm going to further dilute my medication in my 100 milliliter mini bag. So I'm going to swab the port for 30 seconds and let it dry for 15.
You can even do it the safety check there.
And then I will instill the medication into the mini bag.
And then you do the third check.
And this is done. This can go into the sharps. Now I'll disperse the drug. And I'm going to attach a med label, which I've already made. It's for Emma, methylprednisolone, dose is 75 milligrams, which was 1.2 milliliters in a 100 milliliter mini bag. So the concentration is 0.74 milligrams per milliliter. Just zoom in on that for you. So I'll attach this to the bag. Now I'm going to get ready to go to the bedside. So I'll gather my supplies. I need my drug, my secondary line, my MAR, and some alcohol swabs. So I'm going to head over to the room, perform hand hygiene as I enter. Hi Emma, I'm Savannah. I'm a student nurse and I'm here to give you your methylprednisolone. I'm just going to check your name bag here. Can you state your name for me? And your birthday? Okay, do you have any allergies? Morphine? Okay. So as I enter, I'm doing a safety check. I'm assessing her level of consciousness, making sure she's alert and oriented. And I'm also going to tell her what the drug is for. So it's for your MS flare-up. Some of the side effects you might experience are nausea, vomiting, decreased appetite. So please let me know if you have any of those. Would you like me to give you your medication now? She says yes. So she does have the right to refuse at this time, but since she doesn't, I'm going to proceed with my third med check. So, right patient is Emma Wrightson. Right drug is methylprednisolone. Right dose is 75 milligrams. Right route is IV. And right time is every 6 hours, so it's due now. So before I continue, I'm going to just check my primary infusion. I'm going to check the label on it. It was hung at 8:35 this morning, so it's still good. It's infusing at 30 milliliters per hour. It seems to be infusing fine. And I'm just going to palpate around. Do you have any pain or tenderness when I do this? Nope. Okay, so I am not concerned with how it's infusing. So now I will set up my secondary line.
And the dosage
Just
that
lower the
the
primary.
doctor ordered is 150 milligrams, so it is within the usual range of 100 to 500 milligrams every 6 hours. And the single
And I
dose
will
is 1,000
attach my
milligrams,
secondary
so
line.
this is safe, and maximum daily dose is
Just gonna
2,500 milligrams. So
close the roller clamp so I don't lose any drug.
the right dose.
And maintaining sterile
And then,
technique.
because we have a
I will
250 milligram
spike the bag
we're going to dilute that
and hang it.
with 1.8 milliliters.
So I'm going to
of water.
choose to attach it to the port above the baxter pump so that the pump can regulate the medication.
125 milligrams.
So I'm going to swab the port for 30
I'm
seconds.
also going to check the compatibility. So this drug is
Let it dry for 15
compatible
seconds.
with D5W
And then I will
and because the doctor didn't really order any D5W, we're just gonna
leave secondary line.
because it's also the current IV.
Now I'm going to back prime. So
And because we're gonna
fill the chamber a little bit.
That's good.
And
potential
back
hazards
from the
is
line
that,
and watch the bubbles.
The patient can have sodium detention.
Chamber. Once there's no more bubbles, I know that there's no more air in the line. I'll just double check that. It looks good.
We're going to do the vital signs
So
before giving
now
this
it's
because
fully unclamped. I'm going to set my rate. So as for my calculations, I'm going to be giving this over half an hour. So I need to input the rate of 202 milliliters per hour. So 202 milliliters for a volume of 102 milliliters in the bag. Confirm secondary and press start. I'm going to watch for 3 drips. 1, 2, 3. So that's running. I can see the rate, it's running properly. So now that that's all set up, I'm just going to attach my label here so that I know when to change the line. So Emma, your medication is now running. Please let me know if you have any of those adverse symptoms that I was talking about, any nausea or vomiting. We can get that sorted out for you. I'm going to document that I gave the medication, perform an exit safety check, so I'll give her call bell. And once it's all done infusing, I'm going to come back and check to make sure that the primary bag has kicked in and it's running again. I'm going to come back in about 10 minutes though, just to check up on her and make sure it's still running smoothly. So yeah, I think that's it.